I like to start off these discussions by introducing power differentials. The quote that Mark presented while reading my bio comes from the perspective that within the HIV space all over the world, I have a lot of power. I'm actually one of the world's leading HIV journalists. And so if I need something, I know exactly who to call, sometimes a country's director, to get me those things. And that's not the common experience of most people living with HIV. We know that HIV is considered a disease of poverty and low educational attainment, low financial attainment. So when you're speaking about people who are overwhelmingly affected by HIV, you're really speaking about people who have been pushed to the margins and who are there through no fault of their own, but because they were deprived of something that they needed to maintain their health care. So here, power differentials and the refusal to acknowledge a person's expertise in their own care as it relates to medical providers, clinicians. This is a primary issue that I have reported on for years and that I've encountered over and over again. I like to start off by asking people if they've ever heard this statement. If you want a doctor to believe you, have another doctor tell them. My mother, a doctor, told me this. And the point there is that clinicians are often siloed into only addressing each other and only respecting the expertise of their fellows who have attained their degrees. But that cuts people off. Like it's easy to laugh at that, but the thing is what's going on addressed is that as a person living with HIV, we are experts in our own care. And when we are expressing our concerns, we find that they've often been discounted by people who have degrees. When you add other marginalized identifiers to this, anything from a person's sexual identity to their race or gender expression, it creates a space where our needs are easy to discount even further. And what that all comes down to is a doctor who doesn't listen to their patient's needs. I'm sure that that's not true for any of you on this call, but I'm also sure that you have peers who you've seen do this.